The Ebola scare. We talked to an expert about why diseases that jump from animals to humans are increasing and why the trend is not about to change. Also, the tiny ripples of hope in the fight to push back the virus. I'm Affan Chowdhry. Welcome to Globe Now. The numbers don't lie. More than 1,000 people have been killed in the Ebola outbreak, and there are nearly 2,000 other people in West Africa who are believed to be infected. It has been described by international health officials as the largest and most out-of-control Ebola outbreak ever. Now, apart from the immediate public health emergency in West African countries, there is a bigger issue at stake: how to stop the spread of diseases like Ebola from animals to humans. To help us unpack that, we're joined by Jonathan Epstein. He's a veterinary epidemiologist and Vice-President of EcoHealth Alliance, a group that studies the relationship between wildlife, ecosystems, and human health. Good morning, Dr. Jonathan Epstein.
Thank you. Good morning.
What is driving the jump of Ebola from animals to humans?
Well, like so many of these emerging diseases that we're seeing, like SARS or Middle East Respiratory Syndrome, Ebola is one of those diseases that is carried by wildlife. And what's causing these outbreaks are activities that people do that increase our contact with wildlife. So it's been suggested that bushmeat hunting, or the hunting of wild animals, has put people in contact with the reservoir of Ebola, which we really believe to be bats.
Is an adequate response to tell people not to eat those bats?
This is a real difficult challenge because people depend on hunting for subsistence. Now, ideally, what we'd want to do is to change the way they hunt to reduce the risk of infection. So if they need to hunt wildlife, perhaps one, to be aware that there are risks to their health in handling animals or butchering animals and coming into contact with bodily fluid, which is how Ebola is transmitted. So perhaps improving hygienic practices like hand washing could be a simple step towards helping to reduce the risk of infection.
I mean, when you talk about the jump of diseases from animals to humans, it sounds like you're saying that it's going to be very difficult to stop, perhaps impossible.
So this is a real challenge. In different parts of the world, throughout the world, there are activities that we do, not just hunting, but deforestation, urbanization, growing agriculture, putting livestock next to forests. All of these activities put us into closer contact with wildlife, and we need to understand that this is really a matter of opportunity. The more contact there is with different wild animals, the more opportunity there is for their normal viruses to spill over either into livestock or people.
Now, there is growing anxiety about Ebola that extends way beyond West Africa. What do you say to people in Canada and the U.S. who are increasingly worried?
So even though it's possible for an Ebola patient to arrive in North America, our infection control processes, our surveillance systems, and our response will be sufficient to prevent this kind of widespread outbreak that we're seeing in Africa.
We've seen experimental drugs being rolled out. Is that going to stop this virus?
Therapeutics and vaccines, they're an important part of the equation, but it is way more effective, both in terms of lives saved and money saved, to prevent outbreaks from happening in the first place rather than responding to them. So we really need to focus on that interface between us and wild animals and do things to modify our behavior so that we reduce the risk of infection.
Okay, well, thank you so much, Jonathan Epstein. Well, we want to hear from you. How confident are you that there is a coordinated international health response to deal with Ebola? Tweet us at Globe Now. Staying with the Ebola outbreak, the death rate when it comes to Ebola cases is frightening. It is 90%. But it's not all bleak. International aid agencies are working hard to help the healthcare workers in West Africa. And every now and then, there is a glimmer of hope. Take a look.
One of the things we were putting a lot of emphasis on was the cured patients. When they were coming out, it was just like a big party. When we brought them back to the villages and they are cured, it's the impact on the stigmatization and everything on the village it's great. We bring back cured patients in one village and people are super happy. And then when we go to these same villages where there are other cases, people they welcome us. It's more it's easier when we go back to the same places. We have villages where we would go and every time we would bring back the patients, they were dead. They had to be buried. But some cases was completely the opposite. We went to the village, we brought 2 patients and we brought them back cured. So people were trusting the organization, were trusting the care, and they would call us earlier, and then it's a spiral upwards. And things get better, and we have a better success and better outcome.
Well, that's all for today's show. If you've got a moment, hop onto Twitter. What do you think it will take to push back Ebola and stop its spread? Tweet us at Globe Now. I'm Affan Chowdhry. Thanks for watching.